I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. Our guest today is Marion Olivier. Welcome, Marion.
Thank you very much, Craig, for having me. I'm excited.
Yeah, so Marion, tell us what you do in this field.
So the company I work for is called Qlarant Quality Solutions, and our job really is to help improve the quality of services for people who are living in the community. And so we work with states in order to do that. And
so what ways do you do that specifically?
So in several different ways. So we have several different processes that we utilize in order to go out and work with providers and actually interview people who are receiving services and interview their staff, work with them as well in order to say, okay, like, how's it going? You know, how are services going for you? You know, is there anything you want changed? And, you know, tell me about the quality of the service delivery systems that you have in place. And from there, we're able to collect a lot of data and generate reports as well as provide technical assistance and recommendations to either the person and their team that's working with them and supporting them, or also on the provider side, where we're able to look at their systems and practices overall that they're providing to people and be able to provide recommendations on how they can improve the quality of the service delivery overall. And so, you know, that is a very big part of what we do. And
so how does someone end up utilizing your services? Like, is there maybe something that didn't go well and then they reach out to you, or is it just, hey, we want to see how we can do things better, or some of both? Or
well, actually, depending on, you know, how the state wants us to implement the quality reviews that we do, it usually is at random.
Okay.
So for the person-centered reviews where we're working with a single person and their team, it's a random sample that we do every year. But for provider organizations, it might be a little bit different in that, you know, it could be that, you know, they're on a 2-year cycle that, you know, we go and see them every 2 years or something like that. Or, but also, you know, the states do have the option if there's, you know, of a provider who may be struggling, that, you know, they can reach out to us and we can go out and do a special review for them as well. Okay. And the other piece that I want to mention as well is that it's not like, you know, we go out and do the review and we give them their results and we, you know, provide technical assistance and provide recommendations, but then we come back. We go back like 90 days or every 30 days and say, okay, how's it going? What systems have you put in place? What is working? What isn't working? You know, and we have another opportunity to help the provider, you know, strengthen their supports and services that they're providing to people.
So I'm curious, are there certain improvements that you see that you recommend more often than others? Like there are a few key things that, you know, you would be willing to share with us?
Absolutely. Yeah. I think one of the hardest things that providers struggle with, not only because of the pandemic and everything else, and the impact that it had on supports and services for people, but truly supporting people and understanding how to support them in the community and getting connected with their community. It seems that, you know, providers and you know, supports that people have tend to really kind of struggle with that process and understanding like how you can help someone really develop a social role and get really connected to other people who have similar interests.
Or churches or interest groups.
Yeah, I mean, it can be anything.
Yeah,
I mean, you know, if somebody likes trains, you know, and so thinking about, okay, like what are all the things that you can do to connect somebody to trains and find people that have that same interest. So it doesn't always have to be like a group. And oftentimes what we see is, you know, provider and staff, direct support professionals who are working with people, it's not that they don't want to, it's just they might not know the how-tos.
Sure. And we all have to be, trained or taught how to do things that we don't do normally, right?
Yes, absolutely. Yeah. And we actually, we do a ton of training in relation to those for community, supporting someone in connecting with the community. And the other area that we see where sometimes folks struggle with as well is in relation to person-centered practices.
Sure.
And, figuring out, most often, direct support professionals, they know the people that they're working with really, really well. But it's trying to figure out how they can be like more of a coach versus a caretaker, and implementing that person-centered approach, using that as a coach versus a caretaker role, they struggle with sometimes.
I think that's really important, and a really important point that you made. And again, we don't always think that way, and training can help us figure that out, or how to do that better. And we think about person-centeredness or person-centered supports. What does that really mean, and how do we do it? And there are skills that we can learn, as supporters, on how to help someone live a life that balances what's important to them with what's important for them. But it's things to learn. Yeah, so it's great that you help people move in that direction as well.
Absolutely.
So, are there other services in particular that you guys provide?
Yeah, we also, like I mentioned, we do a lot of training. Okay. So we'll help states with actually developing training curriculums and so forth that might target a certain. I think
we've had the opportunity to work together on one of those. Yeah.
Yes, we have, which was awesome. I mean, you guys are fantastic partners. So helping, if a state needs a particular population that they're trying to target, or certain topics that they're trying to target, we'd work with them in order to do that. And also, I guess, we also do the National Core Indicators surveys.
Nice.
Yeah, so we do it not only for the intellectual and developmental disability population, but we also do it for the aging and physically disabled population too.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So, Marion, one thing I always ask guests are to tell us 3 things that they think the world should know that can improve either supports and services, or health and wellness, or just the world for people with intellectual and developmental disabilities.
Okay.
Go for it.
The first thing I think I would say is that, as in any organization, one of the things you want to definitely do is develop performance measures. You have to be able to identify how you're going to determine whether or not you are, as an organization, is providing quality services.
That makes sense.
And so, but in doing that, oftentimes what we see is that they may be measuring more against policy versus looking at measures that really matter most to the people that they're supporting. So my advice is, when you're looking at developing measures, always go to the people you're supporting and ask them what matters most to you, and then that's what you develop your measures against.
I like that. It's sort of related to something that I remember being told when I was in my medical residency training, that look at the patient in front of me is who I need to reference everything that I do around, and is that working for the patient, not whether or not it fits a policy or whatever, or the maybe even in the insurance rules. It's like, no, what's the best thing for that person in front of me? So that makes sense.
Absolutely, absolutely. I mean, you really can't go wrong, and what it does is it makes sure that you're really measuring the right thing, So, let's see. The second thing I wanted to mention is that in relation to evaluating quality, it's always important that you take an opportunity at every stage in your service delivery to ask yourself the question, what can I do better? And oftentimes what we see is organizations, they'll only look at it like once a year. They evaluate their quality of services like once a year or through an annual satisfaction survey or something like that they provide, they get feedback from people who are receiving services. But some of the best organizations that I've worked with and seen actually have it as a part of like their daily routine, that they will
continuous quality improvement.
Exactly. And so taking like even having the direct support professionals, asking themselves, okay, what did I do today that I can do better tomorrow? And it's just as simple as that. And it's amazing how it becomes ingrained as a part of that organization and that community and that mindset of always looking at how can we do it better.
That makes perfect sense.
Yeah.
And rather than waiting for a bad thing that happened and then, what do we have to do to correct it? It's like, just think about it every day. How can I do this better next time? Or, this actually went well, but you know what? We could do it a little bit better. And that mindset, helps move things forward. I like that.
Yep.
And what's number 3?
The third one is that, it's when you're looking at quality of supports and services, it's always important to, of course, have the foundation. You're following the policies and procedures that are in place, that the state has in relation to the regulations and so forth, and ensuring people's health and safety and well-being are, that's your foundation. But it's also important to always look at how can you go above and beyond that. And
let that be the bottom, not the top.
Exactly.
Yeah.
So always pushing the envelope, always, looking at, okay, how can we do this better? Like, and looking at what best practices are and figuring out, okay, how can we get there? And realizing that, there's no ceiling. There's no ceiling there. It's a continuous process. So.
Those 3 things are great for providers in this field, but they're really great just for people.
Absolutely.
To think about. And if we all thought about life in that way, who knows what we could accomplish, right?
Yes, absolutely.
Well, Marion, thank you so much for taking the time to talk with me today, and more importantly, for the incredible work that you're doing in the field.
Oh, thank you so much, Craig, for having me.
If people want to find out more about your organization, tell them how to find you.
You can go to our website. It's Qlarant.com.
Can you spell that? Because it's a little different.
Oh, yeah, you're right.
Yep.
People go, what do you spell that? It's Qlarant.com.
Great.
So
Thanks for joining me.
Thank you so much. I appreciate you having me. It was fun.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.